you'll know that in our breaking news, South Africa has recorded its first case of monkeypox. Health Minister Dr. Dr. Joe Phaahla says the infected 30-year-old man has no history of traveling abroad. To get reaction, I'm joined by the South African Medical Association's board chairperson, Mvuyisi Mzukwa. Very good afternoon to you, Dr. Mzukwa. Thank you for your time. We're learning of the first case of monkeypox being detected in South Africa. We've also just listened to a post-cabinet briefing with the health minister saying that it's really no cause for major concern. It's something that's been around for about 20 years. What's your take?
Well, good afternoon to you, Mpo, and your viewers, and thanks for having us in your program. Like we said a few months ago when it was announced by the World Health Organization, monkeypox has been around. It has been not that bad with a very low mortality rate. But also we must recall that in our country we also have, people with underlying medical conditions who may, even lighter infections may cause serious problems with them. So very important that, we make sure that those that are vulnerable are taken good care of. But otherwise, mortality rate is between 1 and 10% of cases, and usually affecting children as well. So, but it can affect anyone, especially those with underlying medical conditions.
We're hearing that it presents flu-like symptoms and lesions on the skin. When should one be concerned? At what stage, as we all continue to observe?
Well, once you have that fever, but also you develop pointed features like swelling of lymph nodes, and you have that rash, which is like chicken pox, but with very big lesions, compared to it's about 1 centimeter in diameter. So it's quite big, and at that stage, once you start those symptoms, fever, lymph nodes, and you start the rash and all these things. But I think even before you start the rash, you do need to see a medical doctor, even if the symptoms are not complete in the picture.
We're also hearing that it's not spread by being in the actual environment and that you'll have to come into actual contact with an individual. Talk to us about that.
Yes, remember, Mpo, this monkeypox, same like chicken pox, you've got to get the water from the lesion. So if you burst that lesion open and the water is spread around, if you get in contact with that water or that fluid, then you then get infected. So that's why really you've got to be very close to the person for you. In fact, you have to have a contact, not only the person, but also the contaminated surfaces around, that person was infected.
The other factor that came out this morning was the trend that the health minister says has been noted, that it's mostly seen with men who have sex with men. You've also mentioned children also being at risk.
Yes, if you go through that literature, it's because if you have contact, the main issue is not necessarily, it's not a sexual issue or sexual related. It's just a contact. If you have a contact with anybody, even if you do not have sex, if you have a contact with that person who's infected, you'll be infected as well. But also with children, you know how they behave, and also in most cases, the trend has been that you find them in those younger children between the age less than 17 years of age or so. But like I said initially, it can be contracted by anybody, especially those who are having medical who are immunocompromised.
Yes. So the other news is the COVID-19 restrictions having been eased. We're right in the middle of the colder winter months. Government has now done away with the remaining regulations, scrapping mask wearing. What are you, what's your reaction to that?
Well, I think over the past 2 years, we have learned something from COVID-19. We know now at the moment that if you are symptomatic, you need to avoid, regardless of whether you've got COVID or flu or TB, you need to isolate yourself, from, the large gatherings so that you don't spread the condition to other people. But also, we know now that if you put on your mask, if you are symptomatic and put on your mask, chances are that you are not going to spread that much of the virus in the air, and that you protect other people from around you. We've learned again that during the mask mandate, over I think in 2021 or so, 2020, 2021, we have less of that flu transmission because we had masks on. So I think if we do continue with that, like in other countries, even before COVID-19, if a person is symptomatic of a respiratory condition, they put on their mask. So we should do the same and learn from, what we've been exposed to in terms of the pandemic. So those things, and also the washing of hands, it has taught us that it is important to wash hands. And even if you don't have a sanitizer, we still have those things like your soap and water. That will also assist even with this monkeypox that we are talking about. So if you wash your hands, you know that it's not easy to spread it to other people.
So you're advising that people should continue to wear their masks and take some precautionary measures, because as far as Regulation 16A was referring to mask wearing, they were saying that wearing of face masks was to contain the spread of COVID-19, and we know that COVID-19 is still very much with us.
We are saying for those who are symptomatic, and I also believe that with healthcare workers as well, the hospital, the other thing that has happened now was that, this announcement was a little bit tardy. It should have been had people explaining in detail, how do we execute this unmasking, instead of just putting it out there as a blanket statement. So I think there needed to be guidance of the hospitals, the clinics, and other people, even the business people. They need guidance to know, can they still mandate wearing of masks in their institutions? So I do believe that in the healthcare sector, you would understand that we're not only dealing with COVID, we are dealing with other conditions, and healthcare workers, I would expect them to really not get rid of the mask.
Absolutely, because it will cause some concerns when it comes to employees in the workplace, especially healthcare workers, and the conversation around the implication of exposure, who will be held accountable. There are a lot of complexities in that space.
Very true. We know that our healthcare workers have been exposed to TB, and some have died from TB. So very important that we still emphasize. Like I said, this info is going to also assist, with the spread of community TB. Where people, they feel that they are symptomatic, they put on their mask and protect themselves and their families as well.
Yeah, one other question that was raised this morning was the possibility of whether or not this may create some form of confusion where people might now enter workplaces thinking that according to the new regulations you don't really need to wear a mask, but a conversation needs to be had around certain managers and companies on weighing out the risk when it comes to the spread of COVID-19 and other diseases that you make mention of.
Yes, like I said, we needed guidance when it comes to the implementation. But otherwise, in the workplace, there must be a conversation with the workers, as to how they conduct themselves now. Because the mandate on wearing, a mask was a matter of government. But when it comes to, the workplace, things might have to change, on how we do things. Like I said, if you go, for example, the hospitals and clinics, it's not the same as in any other place.
Yes.
So you might find businesses also opting to have their own tailor-made approach, to this regulation thinking.
Yeah.
So I believe that there is obviously things that must be done to to guide the nation, not just throw in a statement like that without a proper guidance.
Yeah, because what the minister had noted was that there's been a decline in the number of reported cases and hospitalizations, and that the reproductive rate of the virus, the test positivity rate, and reported deaths have also declined. Do you think that that was enough justification, especially looking at where we come from with the COVID-19?
Well, you could add, Mpho, that also recently we've learned that through surveys that we've been exposed to this virus, about 90% of the population. If you have 90% of the population exposed already, you have some form of natural immunity on top of the vaccination drive that is still going on. So, but on top of that, the cases that we see have declined and the hospitalization have declined. But it's all the factors put together, Mpho, that would make one go that direction.
Very well. Thank you so much, Dr. Mzukwa. Thanks for weighing in, chairperson of SAMA there, speaking to us about the dropping of the remaining regulations.